Hello everybody, my name is Dr. Vince Gutierrez. I am a physical therapist. You can find me at movementthinker.org. You can find me on the DPT Mentors page on Facebook. You can find me at Dr. Vince Gutierrez on Facebook. You can find me practicing currently at Primary Care Physicians of Joliet. I don't know if I left anything out, but if I did, you can find me on YouTube. So far, we have finished the history taking session. We know what your symptoms do when you do things. We know how your symptoms respond to movement. We know how they respond to time. We know how they respond to resting. We know how they respond to sleep. We know what happens to your symptoms when you move because we've asked you questions about your symptoms when you're moving. We know how your nerves are. We know how your nerves are reacting to movement. We know whether or not your nerves are healthy or maybe not so healthy because they're not getting the signals through to where they should be going. So we've got all of our baselines, and we know how well you move, right? How well do you bend forward and backwards and side and side. So we covered all of that in all the previous videos. If you're interested in learning that, which you should be, because if you're going to therapy for back pain, you should understand why your therapist is asking you what the therapist is asking you, and why the therapist is having you do what they have you do. So please go back and watch those videos. Now we've got all of our measurements, right? We're ready to move you. We're ready to start playing with this puzzle and starting to solve this puzzle. The first thing that we're going to do is have you move, either forward or backwards, and this depends on the therapist. And if the patient is really afraid of moving forward, then we'll move backwards. If the patient is really afraid of standing, moving forward and backwards, then we'll do it laying down, right? The patient really gets to dictate where the session starts. But the therapist's job is to try to move this patient along this chessboard to figure out how can we best affect your symptoms in a positive fashion. So I'm going to give a couple examples. And actually I'm going to give some statistics and then examples behind the statistics. What we know is that 8 out of 10 people that walk through our door are classifiable, meaning we can figure out how you respond to things. We can predict how you're going to present. Now, out of that 8 out of 10, 8 of those, so roughly 6.4 patients, I don't know where you get that 0.4 from, I don't know if it's the bottom half or the top half, never mind. Roughly 6.4 patients are going to respond to some version of bending backwards, whether it's on your belly bending backwards or standing up and bending backwards. Fair enough. Out of those 8 patients, 1.2%, did I do that math right? 8 times 15, 1.4% will respond to bending sideways, some version of sideways motion. Whether it's knees flopped off to one side when you're laying on your side, almost like spinning a can or, spinning a jar open, or bending your hips off to one side, almost like you're dancing, right? And so we know that, 1.2%, 1.4% will respond to that. My math is struggling right now. What's 15% times 8? That's 8 plus 0.4. That gives me, you can do the math. I'm kidding. But out of that 8, 5% will respond to some sort of bending forward. So it's a very small percentage that responds to bending forward. And this is extremely important to know because historically, therapy has really pushed bending forward. And for a very small percentage of patients, right, 5% of 80, so 4 out of 100 patients are going to respond to bending forward. That's not an awesome odd, right? I am not going to the casino to try to win on a 4% odds of winning. And if you look at the research that's in the Journal of Orthopedic and Sports Physical Therapy, they actually talk to this bending forward thing now in our practice guidelines, and they say really it should only be used for certain people, people that respond to bending forward, right? And that's not very many. So six people bend backwards and they get better. 6 out of 10 bend backwards and they get better. 2 people bend forward and they get better. Less than 1 person. 2 people bend sideways and they get better. Less than 1 person bends forward and they get better. We're typically going to start with bending backwards unless the patient really doesn't want to do it, or there is something in the patient's history that tells us that that's probably not the first place to start. Patients that get worse with standing and walking, that may not be our first place to start. patients that get better with sitting and bending, that may not be our first place to start. So this is why the history portion is important, because we can start to classify patients. Now, in the end, it doesn't really matter where we start. What matters is how the patient responds. So let's just say that I have you sitting in a chair and bending forward and trying to touch the floor. If you do that 10 times and you tell me that your leg symptoms increase, that's not good. It's not what we're looking for. That's not the response that we would like to see, because we know there's a lot of research that that response isn't the best response. If your symptoms leave your leg and go into your back, that's a good response, because we know there's a lot of research that tells us that that's a good response. If you haven't picked up yet, we're looking for something very specific. Is there a key to take the symptom out of your leg if it's in your leg? Is there a key to take the symptom from the outer portions of your back to the middle of your back? If we can find that key is the starting point. If we can't find that key, then we really are starting a time clock here to try to find that key, because the research tells us that we should be able to find that key within 5 to 7 visits. And if we can't, the patient may not do so well in physical therapy. So make sure that your physical therapist is looking for that key. Now, when we find the thing that really helps you, and it changed your strength back to normal, or it changed your reflex back to normal, or it reduced your pain by more than 30%, or you noticed that you could get up from the floor better, or you noticed you were getting out of the chair better, or you noticed your sensation was coming back, or you noticed that your neurodynamic testing, thanks John Ware, your neurodynamic testing improved. Now we have something to work with, and now we have to make an agreement. Here's the agreement. You paid me to try to figure this out. I figured this out. Now I need you to go home and work on this. This is a two-way street. I'm not a magician. There's no PT out there that's a magician. Well, there are some black stuff that we can do. No, I'm kidding. There are some ways that we can trick your brain, such as IFC, electrical stimulation, massage. We can actually start tricking your brain a little bit. Heat, we can start tricking your brain a little bit. Ice, I don't know why people use ice too much, but sure, we could start tricking your brain a little bit and numb things up. So there are some things that we can do to trick your brain, but really what we're trying to do is help you. Help yourself. That's our end goal. If we can empower you enough to treat yourself, we'll put ourselves out of business. This is not a good business model, but it's what we should be doing. It's the right thing to do. Teaching patients how to help themselves. So in the end of this evaluation, when we find the key that helps you, I need you to go home and treat this key like a medication and do it as prescribed. If it's prescribed every 2 hours to do 10 reps, then that's what I want you to do. If it's prescribed every 10 reps every hour, then that's what I want you to do. You do what you need to do. Now, your therapist has one more piece of responsibility at the end of the first day. Your therapist has to educate you on what we don't want to happen. If you do this exercise and you see this, we would want you to stop. Meaning, if the symptoms in your leg get worse, please stop. If the symptoms in your back get worse, maybe not so much if your leg symptoms are getting better. But you really should be under the care of a physical therapist who understands this stuff, because not every therapist does, who understands this stuff in order to lead your treatment. Last piece, and maybe this is a piece for me and that other therapists don't do it, but your therapist should be following up with you in 1 to 2 days. If it's a Friday, your therapist should be following up with you on Saturday or Sunday. That's typically not happening. A majority of my patients have my cell phone number. I don't know if it's right or not. I don't know. My wife, she doesn't complain so much, so they don't call me if they don't have to. But a majority of my patients have my cell phone number, because if they need to get a hold of me, I want them to get a hold of me. And if you have to leave a message, I will call them back, right? And I tell them that. Leave a message, I'll call you back. If it's an emergency, go to the hospital. It's rarely ever an emergency, but that is the end of the evaluation. The therapist has tried to solve your issue, and now you go forth and do your part. The next portion of this is what happens after you do your part. Do you come back one of 3 things: better, worse, or the same? And now the therapist gets to put their thinking hat back on again. Hey everybody, I do appreciate you watching this. I am trying to push out information for you because I realize that there are a lot of people in this world that have experienced back pain. The latest stat is 80% of the population experiences back pain. Last time I read it, it was at any one point in time, 5 million Americans have back pain, and that's a lot. We spend a lot of money on a culture on back as a culture on back pain, and we shouldn't have to spend as much money as we do. So please, not all therapists are alike. Just because we wear polos and we wear khakis doesn't mean we all have the same brain. Okay? Find somebody who's good at what they do, and the only way you're going to know that is to see if they're helping you. And if they're not helping you over the course of your first 3 to 5 visits, they better have a good reason. And if they don't, walk away and find a new one. Don't keep rewarding, because that's what you're doing. Every time you go into a therapist, they get paid. Don't keep rewarding bad care. Please. That's my PSA for today. Thank you. I appreciate your time. Have a good day.